Welcome to Audio Abed, your gateway to the fascinating world of data science and machine learning. Whether you're a seasoned tech enthusiast, a curious beginner, or someone exploring the impact of AI in everyday life, this is the podcast for you. Join us as we dive deep into groundbreaking technologies, share insights from industry leaders, and simplify the complex concepts shaping the future of innovation.
Welcome back to the Deep Dive. Today, we're diving deep
into
the world of data science and healthcare.
Yeah.
But specifically, how automated machine learning is.
It's already changing.
Oh, it's changing the game when it comes to diagnosis and treatment.
Right.
And I think this is going to be a really fascinating deep dive.
It is, yeah.
Because listeners are going to get like a shortcut.
Shortcut to understanding this.
Right. This whole intersection of technology and medicine and...
It's so fascinating.
It is.
And so relevant.
Right. Like we're going to get a glimpse into the future of healthcare, which is I'm pretty excited about.
Yeah, me too. It's really timely because, everybody is talking about
AI and automation. Yeah.
AI and automation and how it's impacting something as personal and vital as our healthcare.
Exactly.
So yeah, this is going to be a good one.
Okay, so before we get ahead of ourselves, let's break down this concept of automated machine learning, or as the cool kids call it, AutoML. Yeah.
Yeah.
So for those of us who aren't data scientists, what exactly are we talking about here?
Okay, so think of it this way. Imagine a doctor, right?
Okay.
They're facing this really complex case.
Mm-hmm.
AutoML can actually go through and sift through all of the patient's medical history.
Whoa.
Genetic information, lifestyle data, even the latest research. And it can suggest potential diagnoses that maybe the doctor would have missed.
Really?
Yeah, it's basically like having this tireless research assistant.
Oh, I like that.
Yeah, working 24/7 just to support the medical professionals.
So it's not about replacing doctors?
No, not at all.
Okay, good.
Augmenting their expertise.
Right.
With the power of data.
It's like giving them a superpower, basically.
Exactly.
But,
And AutoML is particularly powerful in situations where,
like where
the human brain might struggle to see patterns.
Because there's so much data.
So much data, yeah. Algorithms, though, they excel at that kind of analysis.
Right.
And they can do it so fast.
Yeah.
Way faster than any human.
Even the most brilliant doctor, right?
Even someone, super smart.
Yeah.
Can't compete with the speed.
You can't compete with a computer.
No.
When it comes to crunching all those numbers.
Exactly.
Okay, so we know that time is...
Of the essence
in medicine.
Oh, absolutely.
Yeah, so a faster diagnosis could mean...
It can mean the difference between a good outcome or a really tragic one.
Yeah, I mean, that's...
Absolute.
Yeah.
Huge stakes.
Yeah.
And it's not just speed, it's accuracy, too.
Accuracy, that's right.
AutoML can really help reduce the risk of human error.
Oh.
And make sure that patients are getting the absolute most appropriate treatment.
Based on everything, all the information?
And all the information.
That's available. Okay, so
yeah.
AutoML, game changer.
It is.
We've established that.
Potentially.
Okay, so for those of us, again, not programmers,
yeah.
How does this actually work? Like behind the scenes, what's happening when these algorithms are...
Looking through the data.
Yeah, analyzing all this medical data.
It is a complex process. Okay. But I think we can break it down to a few key stages.
Okay.
One really important aspect is something called hyperparameter optimization.
Hyperparameter.
Okay.
We'll call it HPO.
HPO. All right. Much easier.
Yeah, much easier.
Yeah.
So this is where AutoML actually fine-tunes the algorithms to get, peak performance.
So it's almost like calibrating a sensitive instrument to make sure it's super accurate.
Exactly.
Yeah.
So you're making sure that the algorithm is perfectly tuned for the medical data it's analyzing.
Got it. Okay.
Yeah.
That makes sense.
Another important element is algorithm selection.
Okay.
So AutoML, it's not just like a one-size-fits-all approach.
Oh.
It's smarter than that.
Huh. Okay. It chooses the best algorithm for the job based on the data, the characteristics of the data, and the specific question that's being asked.
So it's so it has a toolbox full of tools.
Yes.
And it knows which tool
It knows when to grab.
to use for which situation.
Yes, exactly.
You got it.
Okay, that's cool. So algorithm selection, that's a key element.
Yeah.
And then
there's this concept of full model selection.
Or FMS.
FMS. Yeah.
Okay.
This is where AutoML goes even further.
Okay.
It's not just selecting the right algorithm.
It's
fine-tuning
fine-tuning
all the parameters
So it's like
to get the absolute best results.
it picks the right tool.
Yes.
And then
Sharpens it.
to make sure it's
For that specific data set.
exactly perfect for the job.
Yes, exactly.
Okay, so it's like an AI assistant that not only picks the right medical textbook.
Oh, I like this analogy. But it like highlights the chapters and the paragraphs that are most relevant
Perfect. Yeah.
to your condition.
Yeah. Yeah, I love that. That's a good way to think about it.
That's pretty cool.
Yeah.
Okay, so we've talked about kind of, what it is, the theory behind it.
Right.
Now, what about some practical applications?
Yeah, for sure.
Like, how is it actually being used
to improve healthcare.
right now?
Right now. Yeah, great question.
Give us some examples.
So one really cool example is the tree-based pipeline optimization tool.
It's a mouthful.
It is a mouthful.
QPOT.
TPOT. Okay, that's better.
Yeah, much better. So it's being used to design and optimize machine learning pipelines,
Okay.
which leads to,
What does that mean?
basically, it means that we can analyze patient data more efficiently and accurately.
Oh, okay.
And then there are systems like AutoWeka and AutoSclern.
Okay, those are
Another mouthful.
another mouthful, yeah.
But what they do is they automate the sometimes really complicated task.
Of selecting and configuring machine learning algorithms?
So they take the guesswork out of it.
Exactly.
Okay, so instead of relying on trial and error,
Yeah.
AutoML can be like, okay,
They can pinpoint
this is the best approach.
the best.
Because I understand the data
Yeah,
and I know what we're looking for.
exactly.
Okay, so this is just,
This is the tip of the iceberg.
I feel like we say that a lot on this show.
Probably because it's true a lot.
It is true a lot.
Yeah.
So, but
It's really exciting to see AutoML.
it is being used
Yeah.
in so many different healthcare settings.
From diagnosing diseases
Yeah.
earlier and more accurately
Right.
to personalizing treatment plans
Personalizing treatment plans. Wow.
and even predicting patient outcomes.
Okay, it's
Those
funny.
are really pretty amazing.
The possibilities are
Endless,
kind of endless, but
but
there's got to be some downsides, right?
there are.
What are some of the,
We got to be realistic.
we got to be real, what are the challenges?
Yeah. So one
The
challenge
Limitations of AutoML in healthcare.
is making sure that the data we're using
Okay.
to train these algorithms is representative of the population it's supposed to serve.
Okay, so it has to be diverse data,
It's got to be diverse, yeah.
Okay.
Because if the data is biased,
and the results are going to be biased.
the models could actually perpetuate
Yeah.
existing health disparities
Right, instead of
instead of getting rid of them.
solving them.
Yeah, exactly.
Mhm.
So we don't want to do that.
Okay, so even though
It's advanced technology.
we're talking about, super advanced, cutting edge stuff,
Right.
it still comes down to
The data.
the quality of the data.
Yeah,
Yeah.
that's feeding it.
And how diverse it is.
Yes, absolutely.
Okay, so data is super important.
Huge.
And then there's this challenge of
what is it?
explainability.
Explainability.
These algorithms can be really complex,
Okay.
and sometimes it's hard to know.
How they get to the conclusion. How they got there, yeah. It's kind of like a black box problem.
Black box. Okay.
It makes it hard to build trust in the system.
Right, because if you don't know
They don't understand
how it got there,
how it got there, yeah.
it's hard to trust the results.
Right.
Yeah.
And to make sure that the decisions are actually transparent and accountable.
Yeah, that makes sense.
Yeah.
So it's not just about like having this powerful AI.
It's about understanding it.
It's about understanding it
Yeah.
and making sure
That it's aligned with our ethical and clinical standards.
Right. It has
It's got to work for us.
work within
Not the other way around.
our system.
Yeah,
No,
exactly.
yeah.
So, yeah, we have to be excited about this technology.
But also
So,
cautious.
recognize its potential, but also be,
the limitations.
aware of the limitations.
Yeah.
And use it ethically.
Responsibly.
Responsibly, yep.
Okay. I think that's a really important takeaway.
Yeah, I think so too.
So it's not all
Sunshine and roses.
sunshine and roses.
No.
But it is
It's very, very exciting.
exciting.
Think about where this is going.
Yeah, I know. It's a lot to think about.
It is.
But it's so interesting.
It is.
Yeah.
It's fascinating, yeah.
Okay.
Yeah. Yeah, it really is a fascinating dilemma.
It is.
We want efficient healthcare,
Right.
accurate healthcare.
Yeah.
But
it's got to be for everyone.
yeah, we need to make sure that everybody benefits
Right.
and that the technology itself doesn't
create more problems.
doesn't create new biases or ethical challenges.
It's like we're walking this tightrope
We are.
between innovation
Yeah,
and responsibility.
absolutely.
We got to keep both in mind.
For sure.
Okay, so
Yeah.
speaking of delving deeper,
Yeah.
the source material we're looking at today,
Mm-hmm.
it goes beyond just AutoML.
Right.
It talks about something called meta-learning,
Meta-learning. Yeah.
which sounds a little
A
intimidating.
little intimidating, yeah.
It's not, though.
Okay, good.
Basically, meta-learning is about teaching algorithms
Okay.
how to learn better.
Okay.
So instead of just focusing on one task,
Okay.
we expose the algorithm to a bunch of different tasks
Oh, okay.
so it can develop a more general understanding.
So it's getting like a broader education.
Exactly.
Yeah.
Okay. So it can then apply that knowledge
Right.
to new situations.
To lots of different problems.
Yeah. Think of it like, imagine a medical student
Okay.
who only studied cardiology.
All right. So they're a heart specialist.
Yeah.
Okay.
They might be great at diagnosing heart conditions,
Right.
but what happens if a patient comes in with like,
A brain issue.
a neurological disorder?
Yeah.
They'd be lost. Right.
Right.
Meta-learning is like giving that student
A well-rounded education.
a well-rounded education,
Yeah, yeah.
exposing them to all the different specialties
So they can see the whole picture.
of human health.
Yeah.
Okay, that makes sense.
So in healthcare, meta-learning is helping algorithms become more versatile,
Oh, okay.
more adaptable.
Able to tackle all sorts of different medical challenges.
Exactly. Yeah.
Okay.
And this adaptability is so important in a field like medicine.
Because it's always changing.
Always changing,
Yeah.
new discoveries all the time,
Right.
new challenges.
Yeah.
We need algorithms that can keep up.
Yeah.
And meta-learning helps us do that.
Okay, so
Yeah.
give us some examples like, how is it being used?
Yeah.
What kind of impact is it having in the real world?
Yeah. So one area where we're seeing a lot of promise is in drug discovery.
Oh, wow.
So imagine you're trying to develop a new drug
Okay.
for a rare disease.
Okay.
You might not have a lot of data.
Right, because it's rare.
Exactly.
Yeah.
Meta-learning can actually help algorithms
Okay.
learn from similar drug development processes,
Okay.
even if those processes were for totally different diseases.
Oh, wow. So it's using past knowledge
Past knowledge, yeah,
from other drugs and stuff,
to potentially help discover new treatments.
so it could speed things
You
up.
could really speed things up, yeah.
Get those treatments to patients faster,
Which is what we want.
which is what we want.
Exactly.
That's incredible.
Yeah, it's really exciting.
But are there any
Challenges?
challenges,
Of course, there are always challenges.
limitations, anything specific to meta-learning?
One of the big ones is making sure
Okay.
that the algorithms are actually learning the right lessons.
So we have to be careful about
Data.
the data again.
Yeah, if the data used for meta-learning
Yeah.
is biased or inaccurate,
It can make things worse
it could actually amplify those biases,
and lead to
unreliable,
unreliable results.
even harmful results.
Yeah. Okay, so
So data quality,
inequality is like
absolutely crucial.
a theme.
It is.
the-
And then there's that need for
Transparency.
transparency.
Explainability.
Explainability, yeah. We've got to understand how these algorithms are making decisions.
Yeah.
Especially when it comes to healthcare.
Right, yeah. We're talking about
People's lives.
people's lives.
Yeah.
Okay, so meta-learning,
Super promising.
super promising, but also we need to be careful.
Yeah.
Thoughtful.
Yeah.
Okay, so our deep dive into data science and healthcare
Right.
wouldn't be complete.
Without talking about few-shot learning.
Few-shot learning. Okay, what is that?
So few-shot learning is really exciting
Yeah.
because it addresses a fundamental problem in machine learning.
Okay. But
The need for tons and tons of data.
Oh, right. Algorithms usually need
A lot of data.
a lot of data to learn.
Exactly, yeah.
Okay.
But few-shot learning is
Yeah.
all about training algorithms
With less data.
with very limited data.
That sounds almost impossible.
It does, right?
Right.
But think about how we teach a child
Okay.
to recognize a new animal.
Okay.
You don't show them thousands of pictures.
You just point to a picture and say,
That's a giraffe.
that's a giraffe.
And they get it
Yeah.
from that one example.
Amazing.
They can then recognize other giraffes.
Yeah.
Even in different pictures.
So we're giving AI
The crash course.
a crash course
Yeah.
But instead of textbooks,
Yeah.
it's learning from
It's a tiny set.
a tiny set of data.
Exactly.
I like
And
that
this
thought.
ability to learn quickly from limited data,
Could be huge in healthcare.
it has huge potential. Yeah.
Because think about like
Rare diseases.
rare diseases where you don't have a lot of data points.
Yeah. Or if you need to personalize a treatment plan
Right.
for someone with a really unique genetic profile,
Okay, so few-shot learning
it could be a game changer
could be really valuable.
for those situations where data is scarce.
Or when time is really important.
Yeah, like emergency medicine,
Emergency medicine.
critical care.
Wow.
If an algorithm can recognize patterns,
Yeah.
quickly make accurate predictions.
From limited information.
Yeah, it could help doctors make better decisions.
Life-saving decisions, potentially.
Potentially, yeah.
That's incredible.
It's really exciting to think about.
But of course, there's got to be.
Challenges, yeah.
One of the big ones
Okay.
is making sure
That the data
the data, again,
is good.
representative,
Yeah.
unbiased.
Right, because otherwise
Otherwise, the model could,
make bad predictions.
inaccurate,
Yeah.
potentially discriminatory predictions.
Yeah. Okay, so data quality.
Everything.
It's so important.
Yeah, regardless of the algorithm you're
I
using.
think a technique.
A technique.
Data quality is key.
It really is, yeah.
And then we need
Transparency.
transparency.
Explainability.
Yeah. These few-shot learning models,
Yeah.
they can be even more complex
Yeah.
than traditional machine learning models.
So even harder
Yeah, even harder to understand.
to figure out what's going on. So we need to make sure that we can trust these systems,
Yeah, absolutely.
especially when it comes to healthcare.
We're talking about people's lives.
Yeah, it's a big deal.
Yeah.
So it's all about
Balance.
balance,
Yeah.
embracing the potential,
The potential.
but being cautious,
We're being cautious, yeah.
ethical.
Ethical.
Okay.
Yeah. It's a really interesting space.
This whole deep dive has been a journey
Yes.
through this crazy world
Rapidly evolving world.
of AI in healthcare,
Absolutely.
AutoML,
Yep.
meta learning,
Few-shot learning.
now few-shot learning. Wow,
Yeah.
pushing the boundaries.
What's possible in medicine?
Yeah, it's been a great discussion.
It has.
But before we wrap up,
Yeah.
I want to get your thoughts on
Yeah.
the future.
The future, yeah.
Where is all this going?
Where's this all headed, right?
Yeah, data science,
Yeah.
healthcare.
It's an exciting time
Yeah.
to be working in this field.
I bet.
Just seeing these advancements
Yeah,
so rapidly.
so rapidly. And how they're impacting healthcare.
It's profound.
It is.
Yeah.
I feel like
I think we're on the edge.
we're on the cusp of something big,
A new era of
a
medicine.
new era.
Yeah.
Yeah, it really does feel like AI is going to be like
Everywhere.
everywhere. You
In
think.
every aspect of healthcare, yeah. From
Diagnosis
Diagnosis-
to treatment to even like
drug discovery,
drug discovery, preventative care.
preventative care, yeah.
Wow. So we're moving away from that.
One size fits all.
Yeah. The one size fits
We're a
all,
much more personalized approach.
where it's all about the individual.
The individual, exactly.
Wow. So AI is really,
Making that possible.
yeah.
It's pretty incredible.
So as we wrap up this deep dive,
Yeah.
I would bring it back to the listener.
Yeah. What does this mean for them?
Yeah. What does it mean for the average person?
Right.
How is this going to impact
Their healthcare
their healthcare experience
in the years to come.
in the future?
Right. Well, I think one of the most exciting possibilities is earlier and more accurate diagnoses.
Okay.
Imagine
Oh.
a world where cancer,
Yeah.
Alzheimer's,
These scary diseases
can be detected way earlier.
when treatment is
When treatment is actually effective.
more effective. Yeah.
And AI is helping us get there.
That's huge.
It's huge. Yeah.
Especially for these diseases.
Yeah, that are hard to treat.
Difficult to treat. Yeah.
Yeah.
And it's not just about diagnosis.
Okay.
AI can also personalize treatments
Oh, wow.
in ways that we never even thought possible.
Like, what do you mean?
Imagine a treatment plan
Okay.
that's designed specifically for you
For me.
based on your genetic profile,
Okay.
your lifestyle,
Wow.
your preferences.
So it's like bespoke medicine.
Bespoke. Yeah, that's the perfect word.
Yeah.
It's like custom made
It is. It's tailor-made.
for you.
Yeah.
That's pretty amazing.
And this level of personalization could lead to much better outcomes.
Fewer side effects.
Fewer side effects.
Yeah.
And ultimately a more positive healthcare experience.
So we really are on the verge of a revolution
I think so.
in healthcare.
Yeah.
Driven by data,
Driven by data.
powered by AI.
Powered by AI. Yep.
But we can't forget
The challenge
the challenge
of the ethical considerations.
Yeah, we have to make sure
It benefits everyone.
everyone,
Yeah. Not just a select few.
right,
And that it's used.
fairly transparent.
Transparently. Yeah.
We have to respect patient autonomy.
Absolutely.
Okay.
It's a balancing act for sure.
Well, it's been a fascinating journey
It has.
exploring this world.
It's amazing, isn't it?
It is. Data science and healthcare.
So much potential.
So much potential, yeah.
Yeah.
And I think our listeners now have
Better understanding.
a better understanding
Yeah.
of this incredible
A
field.
rapidly evolving landscape, that's for sure.
It's moving fast.
It is.
So thanks for joining us on this deep dive.
Thanks for having me.
It's been a pleasure.
It's been fun.